Chair lays out on second reading House Bill 1787. The clerk will read the bill.
HB 1787 by Howard relating to the establishment of a higher education plan for human papillomavirus education and prevention.
Ms. Howard.
Thank you, Mr. Speaker and members. Let me start by saying that what this bill is not. It is not a mandate on vaccines, but that being said, I have a few things I'm going to share with you. First off, I'm interested to know that on social media, I've been seeing a lot, as many of you probably have been as well, that I'm apparently the reigning queen of the tyranny squad, whatever the heck that is, but I'm going to accept that tyranny squad. Floor queen, thank you. Actually, what I am is a nurse and a health educator by profession and training. And I am obviously up here a lot of times focused on nursing, focused on healthcare, as I am again today. Reminiscent, as I've been visiting with folks about this, of when I first got here, one of my first full session in 2007 was when the legislature voted to nullify Governor Perry's executive order that we mandate HPV vaccine for young children, youth, and young adults here in Texas. In fact, I think the age was like for 6th grade. To be in 6th grade, it was going to be required. That didn't happen. I know Governor Perry since has said that was not the way to have done it, but he tried it, it didn't work, and it set us back. Because this is a vaccine that can actually save lives.
Mr. Speaker,
Ms. Luther, for what purpose?
does the gentlelady yield for questions?
Not at this time.
Not at this time.
HB 1787 is about informed choice. It's about choice. Like people talk about vaccine choice. This is about choice using undisputed medical facts. It requires DISHES and the coordinating board to work together to create a plan to educate Texas students, college students, about prevention, detection, and treatment of HPV. And contrary to what some of the stuff that's been handed out says, I can tell you what it actually says in the bill analysis that this does, contrary to what it says that I'm just about making you do a vaccine. What it asks the coordinating board and DISHES to do is the following: conduct health education, public awareness, and community outreach activities regarding the risk factors, and we can talk about those if you want, the risk factors for the value of early detection of, available screening services for, and options available for the treatment of health problems caused by HPV. This is about giving information that includes, yes, indeed, information about a vaccination that works. But it also talks about what you can do, abstinence, condoms, ways that you can prevent, because this is a sexually transmitted disease that probably most of us in this room carry this particular virus. It is prevalent. It is prevalent. That's in the medical journal. It is prevalent. Most of the time, it corrects itself. It clears up. It doesn't turn into cancer. But 97% of all cervical cancers are caused by the human papillomavirus. Do you understand that? If you know anybody that has cervical cancer, more than likely it was caused by the HPV vaccine. And yes, it's true. 90% clear up, 10% turn into cancer. This vaccine is almost 100% effective in treating and preventing that cancer. And preventing it from happening in the first place. And let me just say, we have I have numbers here about what we're talking about with the deaths in Texas. The Texas Health and Human Services indicated in 2024 that we expected 1,490 Texas women to be diagnosed with cervical cancer. That's on top of those that already have cervical cancer. And they also said, this is a number to hear, 459 Texas women are expected to die from cervical cancer in 2024. 459 Texas women die because of a disease that could have been prevented. I have a few more things to say. The reality is that cervical cancer is the third most diagnosed cancer for women ages 20 to 39 in Texas, and according to the American Cancer Society, HPV is directly linked to 90% of cervical cancer cases. The opposition will say that in 90% of the cases, the body's immune system clears HPV naturally within 2 years, and this is accurate, and I am very grateful for that. However, when the infection doesn't go away, it can develop into cancer, especially cervical, and guys, you need to listen to this. It also can be anal and oropharyngeal cancers, and while HPV is often associated with cervical cancer in women, it's important to recognize the growing threat that it poses to men, particularly with throat cancer. In fact, HPV-related throat cancer is now the most common HPV-associated cancer in the United States, and men account for the vast majority of these cases. This is not just a woman's problem, it's your problem now too, men. According to the CDC, HPV causes an estimated 70% of oropharyngeal cancers, and more than 15,000 men are diagnosed with these cancers each year, surpassing the number of cervical cancer diagnoses in women. So why is educating young adults about actions they can take, including choosing to vaccinate, why is it that can save their lives? Why is this controversial? Okay, so y'all got this flyer. I think everybody got this in your offices, when you walked into the door, or maybe on your desk, I don't know, lots of places. This is the kind of information that is keeping us from passing legislation like this. It refers to the fact that there were 32 deaths. That is not accurate. That is not accurate. 32 deaths were reported to the site where you can report adverse effects, but when they studied and documented in the death records, in the autopsies, they looked at all the records, the reported deaths with available records, autopsy reports, or death certificates describe causes other than recent vaccination. The vaccination was not what caused those deaths. This is stuff that's being taken out of context. Yes, 32 deaths were reported, but there were not 32 deaths that actually happened as a result of a vaccination. We cannot let this misinformation guide our public health choices that can save lives. Don't be fooled by this information. It is misinformation. So let me just say again, HB 1787 is not about mandating vaccines. At its heart, this bill is about educating students with the goal of preventing the spread of a disease that has been proven to cause cancer. If anything, this bill is about choice. It is about giving college students the information they need to choose the best option to protect themselves and prevent the spread of HPV. This is about saving lives. It's beyond comprehension that this is controversial, that we would allow life-saving efforts to be politicized, that we choose to let people die to protect a political scorecard. Mr. Speaker, I move to postpone further consideration of HB 1787 until June 3rd, 2025, and I hope nobody dies in the meantime.